Hello and welcome back to Samingo's YouTube channel, the best place for all things money and medicine. Today, we are going to talk all about your lazy coworker. You know exactly who I'm talking about. That person is always late and taking long lunches, who works less efficiently than you, but is always the first to leave. Why are they always the first to leave? And of course, there's always an excuse, right? Well, even if all of that is true, what's worse is your work gets affected by their behavior. Suddenly, you can maximize your productivity and get that fast bonus because you're doing your work and theirs. As a PA, I hear this all the time. I can't do my job when others aren't doing theirs. My MA is lazy. She doesn't room the patient right away. The receptionist overbooked me again. That's why I'm so far behind today. Ugh, the nurse didn't clean the wound. Now I have to do it myself. Look, I get it. It's frustrating when you have to pick up the slack, but instead of being resentful, I'm gonna give you 2 quick tips to turn the situation around and actually make it work in your favor. The first one is be a leader. You are a leader in medicine, so act like one. Stop complaining about your staff. Leaders lead by example. To lead by example means to guide others through your words and your actions. Make it your intention to inspire others to copy your behavior. Did you know that your staff mirrors your words and your actions? That means if you're lazy, they are lazy. If you don't want to invest your time in them, they won't invest theirs either. People are driven by incentive, and if they have no incentive to show up and give their best, they won't. So instead of complaining about your staff, train them. It's that simple. Take the time to train your MAs how you want them to do things for you. Give them a script to memorize when they are introducing you to a patient for the very first time. Let them know how many patients they can room at a time. Let them know they need to undress the patient and gown them if there may be a possibility for an x-ray. Train them to set up a pelvic room for you before you enter a room, or an ingrown toenail, or an incision drainage tray, whatever it is, have it ready for you before you approach the patient. Train them how to properly write a chief complaint and input any information that might be pertinent to you in the chart. And if they see a systolic blood pressure in the 80s or 90s, say, hey, this is a red flag, call me right away. Instead of throwing your hands in the air when they fail, lean in and put in the work up front to avoid the same disappointments later. I promise it is worth it. Most providers expect their MAs or the nurses to be already trained when they are hired. They are often so disappointed when their MAs or the nurses aren't meeting their standard of care. But instead of labeling your staff as lazy and invest in your staff, most of them want to learn more medicine. They're interested in medicine. And if you give them an extra week or 2, training them on why we do things this way, they are more than likely to make your life so much easier. In my own experience, I've learned that when I train my staff, they are happier, more efficient, and more productive. As a result, my bonuses tend to be much bigger. And also, just in general, treat your staff well. Compliment them, buy them coffee or donuts. Encourage them to practice to their full potential. They'll appreciate it and you'll appreciate it. My second tip for you guys is to remember that you are dealing with people. People, your staff, your patients, yourself, we are all people. We are people who generally want the same things. So when you're working with your staff and train them to get better and better, you gotta treat them like people. If you're upset about a mistake someone made, don't approach them while you're angry. Take a moment to gather yourself and gather the facts and zen yourself out. Once your fuse is put out, approach your coworker very straightforwardly to understand what happened, why it happened, and how you guys can fix the problem together. And if it can't be fixed, you consider the actions that needs to be taken. It may be good to let them know how their mistakes actually hurt the patient, you, or the business, all the while maintaining your professionalism as a leader and as a provider. Some issues can be resolved simply by informing those involved of your dissatisfaction. It does no one any good to let the frustrations build up. Communicate up front. Put the work up front. Here's a quick example. I had a fellow doctor that would always show up late to work every single day. This was almost expected of her, but that wasn't the problem. I didn't label her as a lazy coworker because she was always late. The problem was she wasn't productive at work. She was very slow, super, super slow to see her patients. And we work in the urgent care. You cannot be slow in the urgent care. It's a very fast-paced environment. And as providers, we share the patient load. She would take one patient and I would see the next. And this is pretty much our workflow. I noticed for at least a month, this doctor will be so far behind that her patients would wait about 2-3 hours to see her, which really isn't that abnormal for urgent care standards, but during COVID it was. But because all their patients would get so upset, they would complain, and the charge nurse felt bad. So the charge nurse would come to me and say, hey, Sam, can you take on Dr. X, Y, and Z's patient? Initially, I was happy to help, but over time, it got really annoying. I was just bitter for doing so much more work for the same amount of pay. I finally sat down with my doctor friend and said, hey, what's going on? And surprisingly, she broke down in tears and told me that her mother was recently hospitalized and undergoing extensive medical treatment for a new diagnosis. Her mother had moved in with them, and now she spends her nights caring for her sick mom. And she also picked up a lot more shifts in the past few weeks just to cover her mother's medical expenses. After all of this, after hearing her story, I was much more understanding, but I needed to hear those words out of her mouth, and I need to empathize with her. I don't think she's a lazy coworker anymore, but because I didn't hear her story, I just automatically assumed she was being lazy and unproductive, and I was doing her work. So with a little communication, it really goes a long way. And by the way, since we're talking about treating people like the humans that they are, don't be afraid to learn more about the people you spend most of your awake hours with. You may come to you like your coworker more if you actually get to know them and learn what motivates them. You'll find things in common and learn new things from them. You'll be able to tell when someone is having a rotten day and give them the space or the support that they need. I'm not recommending that you ask every single detail about their life, and I'm not suggesting that you start a gossip circle, but showing a small amount of interest will keep you emotionally intelligent in the workspace and will allow you to connect better with your colleagues. All right, guys, that is it for today's video. I hope you enjoyed these tips, and I hope I inspired you to walk on Monday with a brand new attitude. Be a strong leader. Let me know in the comments below, and let me know if you're interested in more of these tips. I hope you have an awesome day. Thank you for being here, and I'll see you in the next video. Bye.